Really exciting to be here. I've never actually had a chance to share this whole story. I think this is actually the perfect place. So thanks for having me. I'm 24. I finished up at Stanford University undergrad in 2009. And when I was a sophomore there, I spent the summer at a rural hospital in Namatete, Malawi. And this particular clinic was serving about 250,000 people spread 100 miles in every direction. So you literally had patients who were walking 60, 80, 100 miles to access care. And they were met at the clinic by 2 doctors. And this is actually not such a strange patient-physician ratio. You actually have more Malawian physicians in Manchester, England, than in all of Malawi. So these 2 doctors are trying to care for 250,000 people. And like a lot of hospitals, like a lot of NGOs, they tried to decentralize care and shift healthcare from clinics to communities using volunteers, using community health workers. These were retired school teachers. These are subsistence farmers who basically step up and they say, I want a basic drug kit, I want a little bit of training, and I want to provide care in my community. And I was told that there were 500 of these community health workers around this hospital. I was there for 7 weeks, and I only met one of them. He's in the middle of this picture. His name's Dixon. And Dixon always carried this notebook with him, and it was bound by newspaper and clearly really important to him. And one day, sort of curiosity got the best of me, and I asked him to open it up. And he revealed these beautiful handwritten drug adherence charts for HIV patients that he was tracking in his community. And Dixon was walking 35 miles every 4 days to hand deliver these paper reports to the clinicians so that they could sign off on his volunteer work, check in on the patients. So it was clear that these health workers were just as disconnected as the patients were from the clinic and its resources. But it was also clear that there were some tools that could help. I had a better mobile phone signal in rural Malawi than I did in Palo Alto. And I met a guy who was literally living out of a van on the edge of campus with a little bit of funding, coding away and creating this open source software called Frontline SMS. My clicker's not working, but we sat under the tree the next day, and he told me about Frontline. And basically, you can plug a modem or a GSM cell phone into the laptop by USB. You can run a copy of this free software, and it basically creates an SMS hub. So you can manage large amounts of contacts and large amounts of incoming and outgoing text messages. And this is exactly what we needed. And this was sort of my first lesson learned, that I'm just going to learn more from people than from books. So I got a really small grant for community service from Stanford, put 100 phones in a backpack, used my grandfather's old school engraver to scratch ID numbers on the faceplates of the cell phones, smiled at the customs officers on the way back to Malawi, and we went through text message training with the community health workers. So a really simple intervention. And for the first time, these remote health staff were connected by mobile phones and solar panels to the clinicians. And we saw some really exciting things happen in just 6 months. For the first time ever, there was localized emergency care. So 150 patients received care who would not have been seen otherwise. So an example here, we had a community health worker, Pascalia, who texted in when an epileptic man fell into a fire. He was about 60 miles out, and we got the message, jumped on the back of the one free motorcycle with a bag of drugs, and got out to see that patient. And the entire community showed up because this sort of response was unprecedented. We also saw the home-based care team, HIV team, and tuberculosis team shift their routine patient tracking and patient follow-up to SMS. And this produced really significant time and financial savings. Anytime you open up a channel like this, it's going to be used for management, it's going to be used for things like stock level monitoring, and perhaps most importantly and most exciting, they actually doubled the number of patients they were treating for tuberculosis over just 6 months, just by texting and being able to coordinate and do active case finding and symptom monitoring in these communities. So we had all this data, right? And all of that would eventually go on to be published in academic journals and peer-reviewed studies. But it was more important that at the time I was telling stories. So I was blogging from this hospital, and randomly CNN decided to cover it. And all of a sudden, I was spending between 10 and 15 hours a day from my dorm room talking to everybody from ministries of health to grassroots clinics in Uganda and Kenya that wanted to replicate the system. So it was about that time that we realized that this needed to become a real thing. This needed to scale. And so I met one co-founder in the lunch line at Stanford. I met another co-founder when he commented on my blog post, and we pulled together a team. You fast forward a year and a half, we now work in 10 countries, mostly in sub-Saharan Africa, but also India, Bangladesh, Honduras, and Haiti. And really what we're trying to do is replicate models that we know work with tools that we know work, but also to build new things. So I want to talk about one project in particular. This is about a year ago after the earthquake in Haiti. And after the earthquake, there was no 911 system, there was no 999 system, no emergency number for Haitians to use. But the mobile networks were still up, and SMS was still going through. And so I put out a call, and this is a Twitter story. So I don't know how many people are in this room, maybe 200 or so. Hope we have 200 new Twitter users after this, because I've convinced you all. I put out a call that I was looking for someone to help me set up an SMS network in Haiti. And literally 2 minutes later, someone following me from Cameroon put me in direct contact with an engineer on the ground in Haiti who was heading to a mobile operator and was willing to help. 5 minutes after that, we exchanged Skype names. 10 minutes later, with the help of the US State Department, we had secured 4636, which was a short code that we could use. And basically then we piled into a Skype chat. Email was just too slow. So about 100 of us across 4 continents tried to build this system in about 3 days. And actually tried to take the first 4 days of this Skype chat and transfer it into a Word document. And it was about 300 pages long. So it was a really incredible and quick collaboration. And we had to adopt a very particular mindset that the difficult we do now and the impossible takes a little longer. We ended up processing about 80,000 text messages in the first 6 weeks after the earthquake. And most of them looked something like this. We put out a call to radio stations that we wanted people to text in their need and their location. So it was in free form Haitian Creole with vague references to where people were. And to make sense of all that information, we really needed a human network. So we used Facebook, we used Twitter, we used labor unions and radio to put out the word for volunteers. And about 2,500 people showed up. So these were Haitian Creole volunteers from all over the world who were translating, categorizing, and mapping every single one of these messages. And they were passing these reports, these mapped reports, on to about 200 college students, mostly in Boston in the US. And these were crisis mappers. They were honing the coordinates and then passing actionable reports on to first responders on the ground in Haiti. We saw different types of actions taken. So one example, we had an IDP camp of about 2,500 people. And over the course of a day, we received a flurry of messages saying they urgently needed food and water. Red Cross went out and verified those reports. And the next day, this IDP camp was included in aid logistics routes. But the stories were also really personal. We had a woman who was bleeding out during labor, and a bystander texted in. And luckily, Apo, one of the volunteers, who happened to be online in the dead of the night, was from that block and had the latitude and longitude pinned to 5 decimal points. And the US Coast Guard was responding in about 10 minutes. We also heard from clinics that had extra patient beds. We heard from clinics that needed diesel fuel urgently. So the needs really changed over time. So the red, the initial initial spike, these were deaths and missing persons. We saw a shift to collapsed structures and search and rescue requests pretty soon after. And towards the end, a much larger bulge in food and water shortages, as well as general health needs. So that was one way to look at the messages. And this is another. That's just a very simple word cloud. And as you can see, the most common word that was texted in was help. maybe unsurprisingly, but I think amazingly, the second most common word was please. These are people in crisis, and the second most common word they use is please. So that project told me and sort of taught me to keep pushing. And the second line is sort of it's very personal, but I wanted to share sort of a process of listening to my teammates, listening to the communities that we're serving, listening to our users, and then dreaming, setting a vision based on what you've heard, and finally acting on that vision before repeating. And for us, that means we're going to push the technology a bit. So we're building mobile apps that'll run on $10 handsets. We're building electronic medical record systems that'll run with low electricity and with no internet, so basically anywhere you have a mobile signal. We're building new mapping techniques and new natural language processing mechanisms so that we can use machine learning to make sense of large amounts of unstructured data. And we're also looking at new partnerships. So basically, a lot of what I'm trying to do is find brilliant people and make them my best friends and teammates. And so Dr. Ozcan basically figured out how to hack a $15 camera phone to do intracellular imaging. So you can actually slide a blood sample into the back of a cell phone and shine an LED on that sample and catch a holographic image on the camera phone chip, transmit that image by MMS, by picture message. And then what will sit within our software is actually a pretty simple algorithm that compares the incoming image to a cell library and will shoot back a diagnosis. So this will auto-diagnose malaria, certain STDs, it'll do complete blood cell counts, and perhaps HIV tests, tuberculosis tests, and CD4 counts. So we're really excited about where that's headed. But we're also looking at ways that we can be resourceful and creative in gathering support. So I was hit with a statistic about a year ago that in the United States we are putting into desk drawers and into trash cans about 500,000 mobile phones a day. And what we realize is that every single one of these mobile phones is worth something. The average is about $18 in the US. And so we created a campaign called Hope Phones. And the pitch is that you can give your old phone a new life on the front line of global health. So we take the phones in the US, we recycle them, we pay for shipping, pay for handling, pay for the recycling, and every phone's worth something. So that green process produces funds. We then use the funds to buy phones in local markets. So it's a green process in the US that lets us fuel our mobile health initiatives abroad. We have really big goals for this campaign. There are, by some estimates, about 10 million community health workers around the world. And I think that 100% of them should have a means to access their local clinic that's not walking and not bicycling. So when I think back to the people I've met along this journey, to Dixon in rural Malawi, to Ken in his van at Stanford, to my teammates, to the Haitian volunteers and the crisis mappers, to you all, sorry for the picture, it's from my iPhone, to you all, I can't help but feel that what I'm interacting with is a relentless and positive storm. And it leaves me really excited, and I think the future is bright. Looking forward to your questions. Thanks.